Borodar, good morning everybody. Welcome to this meeting of the Social and Healthcare Overview and Scrutiny Committee. Monday morning, which is a rare meeting date for this committee, so welcome all. We'll start with agenda item 1, which is apologies for absence.
Borodar, diolch Mr Cadeirydd. We've had one substitution, Councillor Sean Bibby for Councillor Gina Madison. Thank you, diolch.
Agenda item 2 is declarations of interest, including whipping declarations. Would any members like to make a declaration? Councillor Lister.
I am a governor at Ysgol Caernant, and they are named in the report for the early years. Sorry, I can't remember which number it is. 9, agenda item 9. So I'm declaring a personal interest there. Thank you.
Thank you, Councillor Lister. I can't see anybody else indicating to make a declaration. So we'll move on to agenda item 3, which is the minutes of the previous meeting. They are on pages 5 to 10. Councillor Mackie?
Move, Chair.
Move the minutes. We've got a seconder. Councillor Healy. All those in favour of the minutes? That's carried. Thank you very much. Agenda item 4 is urgent matters as agreed by the Chair. There aren't any, so we'll move on to agenda item 5, which is forward work programme and action tracking.
Diolch Cadeirydd. So the forward work programme, we've got a meeting in June and a meeting in July. There is one item that will be coming onto the agenda, and I'd just like to bring the Chief Officer in to explain regarding the CIW inspection. Thank you.
Diolch. So to update Scrutiny, last week we had a CIW inspection of adult social care. So it was a follow-up inspection. So in 2024-25, we had a full performance evaluation framework inspection. Last year in July, that was followed up as normal practice with an inspection of children's services. And last week we had a follow-up inspection of adult services. Now, normally there's a timeline between an inspection, local authority receives the report, and then we take that through our political cycle. Things will be slightly different this time because we're just about to enter into the pre-election period. So the report, the final report from CIW, will be later than normally we would receive. So I just want to be transparent that we're advised that don't know who it was, that we should receive the final report on the 16th of June, which will be embargoed to the 18th of June. If that timeline happens, we would then need to schedule it through all the political timeframes. So it could be as late as September by the time it arrives here. But I just wanted to explain to Scrutiny why we're in that unusual phase. So it will go into the forward work programme as soon as we can get it in, but it will be delayed because there'll be delay in us receiving it. Thank you.
Thank you, Chief Officer. So moving on now to action tracking. So we've got rota visits. Has anybody done a rota visit? Councillor Mackie. But you have done one. So they are actually. Yeah, brilliant. Thank you. That's good. So that one's going sort of. So we'll put that mark that's completed. So that's moving again. That's good news. Councillor Lister, I think, and your that's work in progress. That's moving. The two items then regarding the budget, which Councillor Claydon raised, it was discussed at the first CCWG, and it's on the agenda again for the April meeting. So I think Steve Goodrum was making some inquiries.
Councillor Claydon.
Yes, is it possible to have a report back on discussion here?
Yeah, I'll make inquiries with Steve Goodrum. Obviously, we're not meeting again now till June, so we will circulate a response to you. Thank you. Okay, so moving on, we've got the visit to Wrexham Mailer, we have had an expression of interest. I think 6 members have said that they'd like to attend. So that is, we're hoping to arrange. There's a couple of dates in April that we're working to. So hopefully we will have a confirmed date by middle of this week. And then the issue with Councillor Thu, my understanding is that Councillor Thu and the Chief Officer have met, and the Chief Officer is progressing that with the Chief Officer Community and Housing. And then the final one that's closed, it's if members do want to contact Mark, then that's feel free to do so. Thank you, Chair.
Thank you, Margaret. Would any members like to make any suggestions to add on to the forward work programme? Or any comments on the action tracking? Can't see anybody indicating, so we'll move. Okay, Craig.
Just to remind committee, so I will be bringing the Director's annual report for consideration here. And last year, what we did as a scrutiny committee, we looked at that, my assessment of social services and the areas for development. You then determined the forward work programme, what matters you would like to see in the forward work programme. So I suggest that when we present the annual report, we also put some time aside to then thinking through what reports you would like to see during that year to assure yourselves that those priorities are being delivered on time and to the quality that you'd expect.
Thank you, Craig. We've got the usual 3 recommendations. They're on page 11 of the agenda. Do I have a mover for those? Councillor Lister. Second, I've got Councillor Buckley online. All those in favour? That's carried. Thank you. We'll move on to agenda item 6, which is access points into children and adult services and our approach to continuous improvement, and I'll pass over to Sarah to introduce this report.
Thank you, Chair. Bore. So I'm going to just take you through the report that you should all have in front of you with regards to the access points into children's and adult services. So you'll see from the report, focusing on children's right now, there are currently a number of pathways and access points to receive information, advice and assistance across children's and adults. This report will hopefully provide a summary of the current position and identify an opportunity to streamline and strengthen our approach. We're constantly looking at how we can improve that, streamline and speed up the response. So this report will give you an indication of where we're up to on that journey. This report will also set out how children and families currently access early help and early intervention services and support, and what happens when they first make contact and how the system is developing to improve consistency, reduce duplication and deliver better outcomes. Within adults, there are 2 primary routes for access to support, depending on circumstances, and this report will also bring a lens to these gateways as we introduce opportunities to align and coordinate pathways. I'm not going to labour the whole report, but I will pick out, you've obviously got that in front of you, but I will pick out some of the kind of the key areas really. In terms of what our response looks like in children's first contact team, it's a front door support and to statutory services also. It's the gateway for everything. So our front door, our first response, it has a responsibility to triage all referrals received by the portfolio, whilst applying a focused risk analysis as to whether children are at risk of significant harm, child protection, or requiring some type of support services under a care and support plan. Those risk assessments are being made all day, every day. So we have a core staff group that are constantly looking at those referrals that are coming in and applying that initial risk assessment in conjunction with management oversight. The role of the Children's First Contact team is to manage all the referrals sent either electronically into Flintshire Council's child protection inbox or by post or verbally by telephone. Likewise, on occasions, referrals may be processed internally from current social workers already involved with a particular family. So it will come in through our front door, and then they'll see that the family are already open, so it will be sent through to the right team to make that decision on next steps. You can see some of the data there. October to December 2025, Children's First Contact Team received 2,693 referrals for support and safeguarding, and those figures continue to rise. We're seeing a lot of increased demand at the front door. In addition, there are high levels of information received on children already open to the social work teams and early help services. The education line is something Flintshire Children's Services are very proud of. This is a line that was brought in on the back of the Care Inspectorate Wales inspection, and actually has really proven to be most effective in terms of that sharing of information and for education to be able to have that direct dial-in to get quick advice and guidance. The partnership feedback from this is that it's extremely valuable, and actually we continue to look at ways that we can almost provide that service, not just to education, but to other partner agencies as well. So we're constantly looking at how we can improve on that, because it's been a really valuable aspect of that partnership working at the front door. There's a robust and effective partnership between the front door with our other multi-agency partners. We have our Children's First Contact Team Hub, which is held daily, and actually that's multi-agency. There's discussions held around that hub, and actually the police attend and other multi-agency partners, so we can really have that lens on the family, the situation, the crisis, actually what needs to be done next, and that it might not always sit with children's services. It might be something that needs to be held somewhere else, so with a different partner agency. So it's really valuable, and rich information comes into that hub every day. CIW, when they came in, recognised the local authority has taken steps to improve this, including the joint funded education worker. So we have a worker that sits in our front door, part funded by education, extremely valuable for us, and actually and for education. And the added value that staff member has provided is proving to be really rich in terms of that joint working, the response that we're able to do, the link in with the schools, the direct link, and also the linking across children's services teams. So we continue to look at how we can develop that role. So timely action at the front door prevents delay for children, including whether child protection action is needed and if a statutory assessment is needed. During the last year, there's been a significant amount of work carried out at our front door in children's to improve process, practice and responses. I've actually got a meeting later today to look at the next steps in terms of how we future-proof that now moving forward. So there's constant meetings around us looking at that, the staffing, actually the response, and how we can continue to pull our agencies together. During our most recent improvement visit, CIW recognised there was a range of early help and preventative options available to support children and families, including children diagnosed with MD, neurodiversity, who are awaiting an assessment for a potential condition. In Flintshire, we're really proud of the fact that we're supporting a lot of families that are in that threshold, where they're not open to health, where they are kind of stuck really in that area of they're waiting for an assessment, but their support needs continue to rise. So we're doing some really intense work at the front door and how we help and support those children and those families right now. You can see what the data is telling us there. That's self-explanatory. In terms of triaging referrals, what we know about there is that actually children who are at risk of harm, they need that quick response. And actually we do that well in Flintshire. We provide that quick response, that quick analysis. Everything is RAG rated, and actually it's the right team at the right time. and the right person at the right time. In terms of what the data is telling us around referrals, between October to December 2025, Children's First Contact Team sent in total 721 referrals and contacts to the Early Help Service. So that really does show how that risk assessment, that analysis, that screening, and actually can these families and can the support be provided at that earlier help. So you can see there that we're very busy, constantly moving things and sending children and families into the right area at the right time. You can see there around the contact sent to IAA, which is information, advice and assistance. And what these figures continue to evidence is the need for preventative services for children and families. And we're constantly looking at how we can continue to develop that preventative offer. In terms of the routes specifically into early intervention, there are currently 2 direct routes into the early intervention service. That's through screening, what I've just spoken about, where it comes in through the front door from Children's First Contact Team. And actually they can also come in through the Early Help Hub. So the Early Help Hub is the hub that sits within the Early Help Service, and actually, again, is a multi-agency hub that actually brings all the partners around who can then look at the next steps. What these routes offer is flexibility. They can also feel overwhelming at times, particularly for families and partners who are unsure which pathway is the right one for their need. So that brings us on to really in terms of how we're kind of moving forward to streamline more of this. So we've got our front door, we've got our pathway, but actually where we go from there, because there's quite a lot of access points that people, children and families can come in through. There are, in terms of the workforce behind the response, the work is carried out by trained officers, their team around the family. Officers are used to dealing with a wide range of family situations, and all officers have completed or are working towards the first year of their social work degree, which is really important because obviously that risk assessment and that understanding of children and family situation in terms of that knowledge is really important. Safeguarding practice, ethical decision making and professional curiosity as everything that underpins the model that is driven in there. One of the most valuable aspects of the information, advice and assistance service is the ability to be to offer clear, informed advice early on. So in many cases, families do not need to wait for a formal referral or sit on a waiting list to get help. They need reassurance, guidance or practical advice from someone who understands and can signpost and guide. We do that really well in Flintshire. The IAA service can do this, often resolving concerns at an early stage and preventing issues from escalating. When more support is needed and early advice is not enough, IAA officers will complete more in-depth assessments, taking time to understand need properly. And then this information feeds directly into the Early Help Hub. And what will happen then is you will have those other agencies that are in there that can add value to that information. Through direct access to the Early Help Hub, families can receive a bespoke package of support shaped around their individual circumstances rather than a standard offer. So you'll see from there that the Early Help Hub brings together 16 partner agencies into one coordinated approach. This way of working has significantly reduced duplication and improved clarity for both families and professionals. Families are currently able to also self-refer to the Early Help Hub, which removes barriers and allows an earlier access to support, which is really important. Families don't always want to feel that they're coming through because a professional has sent them through, or that they feel that potentially they're under that lens. So actually to be able to self-refer is really important for families. The role of the team around the family model plays a key role in keeping support focused and effective. So once early help has been agreed as the right service, at present families can access the early help and support, which can then actually decide if they can stay at that level or if they need to go anywhere else. And that's really around how the families respond to that support. And at that early stage, it's really important that actually they have that voice and that choice and that control in terms of what they're able to access for themselves, how they feel the direction of travel needs to be for them as families. You'll see there at 1.10 what the data is telling us from the last 12 months for early help. So the recent activity has shown the scale and reach of the system. That's all self-explanatory there in terms of the data, but it highlights just how important it is as a front door, and actually how we continue to look at how we can expand that and have that as a really big offer for our communities and our families. The next steps and the work that's underway, we have thought about having IAA officers sitting within Children's First Contact Team. That's one thing that we're looking at the moment, to bring that lens really into that kind of initial screening rather than then actually having to send them on. So we're looking at that. And actually from April, one referral pathway from April will bring our early years and our early help lens and focus together. So from April, all families' first referrals will move through one single referral pathway via the Early Help Hub. This is a significant step forwards towards a more joined up early help system, which is what we're aiming to do. This will change. This change will simplify access for partners where there's lack of clarity at times, improve the speed and appropriateness of allocations. It will strengthen the data and quality and oversight, and make it clear who is supporting each family to avoid that duplication. Because at times, maybe IAA, early help and early years are involved with the same family. It's how we actually join that up and so avoid that duplication. So that one pathway will be really, really important. In terms of the next phase of work, this is exciting around a move to a single referral pathway, but also the development of the family hub model. Again, that isn't for today, but actually what we're thinking about is how we bring that pathway, that one pathway, and then actually that feeds into a family hub model down the line. So that's what we're working on at the moment. So that's kind of children's really. This report will focus both on children's and adults. I've got my colleague Ben, who's sitting the other end here, who knows much more about adults than I do. But I will just do an oversight of the report, and then if you've got any questions for Ben around adults afterwards, he's your man. Okay. So in terms of adults, in the primary role for most contacts with adult services is the SPOA, so that's the single point of access. The SPOA operates 5 days a week, provided the option for citizens and partners agencies to contact a team of SPOA officers who provide initial information and advice following an initial what matters conversation. In many cases, no further service or support is required, with citizens having gained details about community or third sector groups who are able to support them or advise on options for self-help where that is appropriate. In December, members received a report by the Chief Officer for Social Services that introduced a framework of support for adult social services. In December 24. This framework illustrates a graduated response from social services based on complexity of need, with levels 1 and 2 primarily being delivered through the information and advice offer that is offered through SPOA. Where the initial conversation identifies that there are additional needs, a full assessment and or a more complex response to assist in meeting outcomes. It's very similar to children's, that kind of gradual approach in terms of early help, and then more assistance is needed, more needs are identified, so we go into that assessment process. Providing a response that is timely and as comprehensive as possible within the SPOA provides an opportunity to improve outcomes and enable individuals to be as independent as possible whilst growing their community networks. There's an area here on the report that's 1.14, that what the data is telling us, numbers and contacts received and the response received each quarter. So there's some key data there for between 23 and up to quarter 3, quarter 1, quarter 2, 25, 26 data you can see there. the referrals passed to teams, information and advice only. So there's some quite rich data there. In terms of the Carers Gateway, the Carers Gateway service provided through a contract arrangement by the North East Wales Carers Information Service, or the short version is NewKIS, that you will all recognise. It provides a single and open access gateway for all carers, adult and young carers, their families, professionals and partner organisations to access information and make a referral. The gateway is a one-stop shop for a range of information, advice and access to assessments, and the service includes the following elements, which you can see there: information, advice and signposting, and promotion of the service and awareness campaigns such as Think Carer. It's an expectation of the Adult Carers Gateway that the services provided are inclusive to all types of carers, accommodate their individual circumstances and explore new ways to engage and support the next generation of carers. What is the data telling us? The number of new contacts by carers received by statutory social services during the year where advice or assistance was provided. And you can see there all the data there, which you may or you may not have some questions around. Whilst these figures appear to show that the increase in demand has levelled off and may potentially drop in the current year, it is important to note these figures are reporting new contacts and does not take into account the number of carers already open to the service. The increase in complexity of cases in recent years means that more are remaining open and involved with the service, whereas in previous years they would have been closed and a fresh contact opened at a later date if required. Furthermore, the figures reported here in Flintshire are consistently significantly higher than those reported by other local authorities across Wales. So that's obviously an important point to note. What the future looks like. Work is underway to move towards a family hub model within children's social work. This will be a significant opportunity to bring services together more clearly, give families a consistent message about where to go for help, and reduce further duplication across the system. We will also be exploring the alignment and synergy with our family information service. There's also an opportunity to bring additional synergy between children's services and adult services with this model. And I think it's really important that we look at that in terms of the generation, across the generations in terms of that family hub model. The aim is not to create something entirely new, but to build on what already works across the services. Is also an opportunity to bring our partners closer and consider co-location to reduce costs and to improve further outcomes for children, for families, children and older people across service need and generations. I think I've covered everything that I needed to cover on that report. So if there's any questions, thank you.
Thank you, Sarah. I've got Councillor Mackie first.
Thank you, Chair. Thank you very much. Yet again, I have to remind myself that this is scrutiny. And I'm saying that because scrutiny implies examination of, it involves testing and that sort of thing. And I don't want to do that. And I don't want to do that because what we're hearing, I think, is a department which never stays still, which moves forward all the time, which is testing what it's doing and seeing whether or not it should be moving into slightly different areas and expanding what it does. I vividly remember, and I hope I got this right, when we were first told about the need for a second line when referrals were made to children's services which didn't meet the threshold. And I think it was Craig, I think it was the chief officer who presented this to us at the time and said, these people need something, but we don't have it. And so we're going to set one up. And I think it was the early help hub. I could be wrong. Because this is all from memory. And if that wasn't that long ago, really, if I can remember it. But we've now got all these different systems, situations, that have sprung from that. And we're talking of even more. We're talking of moving on. And I really feel that this is what we should be hearing, and this is what we should be seeing, and this is what should be happening within the local authority. This is the model, if there is to be one, that I think we should be following, because everything can get better. And that's really providing better services for the people who live in this area. And I don't think that there's anything wrong with that. In fact, I applaud it. So coming back to my first point is, this is scrutiny. It's very difficult to scrutinize this. I could sit down and I could say, well, let's have a think. So we're doing all this work, we're adding all these extra processes into our system. We must be saving something somewhere. And I could say, I'd like to know what we're saving. But it's not that, is it? What we're doing is we're providing services to people who need them, which don't fit into the services we had before and the processes we had before. These are new processes. In themselves, they're giving us information about further new processes. So it's not a matter of saving, it's a matter of providing services which we weren't providing before and probably weren't thought of. So I haven't really got any questions, and I don't know whether anybody wants to say anything about that, but that's my reaction to this report. Thank you, Chair.
Thank you, Councillor Mackey. I probably will give you some areas that you might want to scrutinise, because as Chief Officer, I want to be really transparent around and spoken around the journey we've been on in children's services. I think that we are particularly challenged at this point in time around adult services. So what we are seeing is more and more demand and more complexity coming through to our front door. We are also, you'll be well cited on the demand and the need that flows through from hospitals and the work and focus that we're giving to making sure that as far as we can, we give a timely and effective response to our hospitals. However, where we are at this point in time is that our attention and capacity in supporting hospitals, and that is absolutely right, the demand in communities and the complexity of need in communities, we are at this point in time not keeping at pace in being able to respond to that demand. So what we're seeing at our front door in SPOA is people come in and asking for help. Our SPOA officers do a great piece of work around kind of, Sarah's talked about the level 1, level 2 information, advice, assistance, support, getting people on the right pathway. But not everyone can be supported in that way. Other people need care and support or need a social work assessment. The reality is that when things are passed over to our localities, because we've had so much focus and demand led through the hospitals, we're really thin, I would describe us, about our capacity and resilience within communities and locality services, which means unless a situation is urgent and needs an immediate response, then people are going on waiting lists. And part of this work is about starting at the front door and looking at, are we able to front load some of our skill and expertise into the SPOA so that we can offer more immediate response to those people and extend the work that we can do to support people then. But following through that, and this report is only looking at the front door, but we know where we're going. The next bit is looking at, obviously, workforce recruitment and how do we get more people into our localities? How do we effectively and risk manage our waiting lists, and how do we reduce those waiting lists? how do we use technology to support practitioners so they can get on with their job and not doing recording. So there's a whole piece of work that's going to follow from this. So just as a few years ago, we came and said we need to do something different in children's, like you described, Councillor Mackey, I would say and contend we're at that point in adult services, that the demand and complexity of need, we need to be doing different things because too many people are going on waiting lists and waiting too long. And we have to be transparent and upfront around that. And we need to be able to expand our workforce. Ben, as service manager, I don't know if you want to add anything or reflect that. Or...
Thank you, Craig. Thank you, Chair. No, I agree. We are having continued issues with recruiting and in some cases retention in some teams. Unfortunately, most of the issues about retention is people moving to different teams in the council. Lots of people going to the hospital team. So everyone likes staying working here. They just may want to go and have a bit of a change. So we are continuing looking at different ways of getting new staff in. We are going to Wrexham University in 2 or 3 weeks to visit with the Year 3 social work students there. We've got a number of managers and senior managers going. Are you going, Jane?
Yeah.
Yes, Jane's going. So we're continuing with that, trying to get people in as soon as we can, and we're continuing with our grow your own homegrown strategies as well. Unfortunately, as Craig mentioned, the waiting lists are large, and as staff retention is difficult, or numbers of staff in the teams is difficult, that waiting list becomes harder to manage. So we are really needing to increase those number of staff now. I think I'm probably moving off the topic of the front door and more into my day-to-day work. But yeah, our front door is being reviewed currently, and we have a meeting coming up with Better Gov to do some. We've already done some mapping of the processes, but we're now they're going to be coming in and sitting in with the staff and really seeing what the staff are doing on a day-to-day basis and see what efficiencies we can make within that work as well. And we're hoping that was going to really provide an outsider view as well, because when you're sitting in it, you can't always see what you can improve. Yeah, I think that's probably it for me.
We've got Councillor Claydon next.
Thank you, Chair.
Thank you, Chair. Actually, you've just covered quite a lot of what I was going to ask about. I was going to ask about staffing problems and what's going to happen there. And but I do wonder about people on the waiting list. You know, are we confident that those people on the waiting list aren't going to become an emergency response if we leave them there? That's something that worries me. And the other thing that I would be quite interested to see is some sort of analysis of customer satisfaction, because I've had a couple of people over the last year that said, you know, they didn't find SPOA helpful. And I'd like to be reassured that at least we're doing all we can in this this area. Thank you.
Thank you. So in regards to waiting lists, they are mostly held within the locality teams, and there is a duty system in place to support. So people on the waiting lists are screened regularly. The managers and deputy managers make contact and leave their direct numbers. So if anything does change, they're asked to come back in contact with us as soon as possible. Sadly, sometimes things do turn into emergency situations, and we do have a duty response that can support those people as soon as possible. But our goal is always to get in and sort of support as early as we can.
Can I just add, so some of the work as well that we're going to be doing is looking at, as Ben said, we have processes to review those waiting lists, but we know that there are other areas in the council. So Sarah's talked about RAG rating and about how we risk manage in a much stronger methodology our waiting list, because we have to accept there is a waiting list. It's how we manage that. So one of the priorities that will be coming when I present my annual report is a focus on that. But also your second point is what's quite clear. We've done some work, when I say we, it's Jane and her team, on our performance management and quality assurance framework. And there's a draft that's just about to be finalised, and that has a real focus about how do we get more lived experience from our residents, so to understand their experience, good and warts and all, about what it is like to ask and receive a service or not receive a service from Flintshire. I think what we've got at the moment are pockets. So I'm thinking reablement, they have a questionnaire, don't they, Ben, around gathering feedback, but I don't think that's routine across the service. So what we want to do as part of the launch in the performance management framework is really get better at understanding experience and what we're going to do, what's that telling us, and how do we respond. So absolutely accept that it's an area we need to get better at, and some plans that we've got in place to do it.
Councillor Lister.
Thank you. Yes, thank you for the report. I have got a couple of questions, and the first being about child to adult services and the front door there. And that question comes from some casework, really, where somebody didn't really fit into either service but did need some help. So I was just wondering if you could provide a bit more information about what the front door is for those people that are perhaps right at the end of childhood, who need some long-term support but don't perhaps fit into childhood services, and the support is going to be for more when they're adults, and how they can access that support. And then the other thing that sort of sprung to mind as I read the report and as you were talking, paragraph 1.12, the one referral pathway from April. I think really what I want is some reassurance that we're not narrowing the net, and that there has to be a lot of, there are lots of people that can refer because they're concerned about vulnerable children. And I almost feel that as many ways as possible into the service is a better approach. So you cast a really wide net, and most of those probably don't need anything, but that you can guarantee that you're going to catch the ones that do need it. So yeah, I think maybe I just need a bit more explanation about what that one referral actually means, and that it's not sort of narrowing options for people into children's services. And the only other thing that I didn't know whether I should raise now, at 1.07, it talks about when the support is needed and early advice is not enough. And that I felt really links with the education portfolio's Families First programme that's gone through recommissioning. And there's certainly been some casework come in where Action for Children can't provide that early help anymore. So I was just wondering whether there was an opportunity for education and for social services to work together to make sure that gap is addressed. Thank you.
Okay, I'll try and remember all that. Okay, so just in terms of child to adult query that you raised, I think it's obviously something that we're very aware of in terms of those young people that are on that transition. I guess the reassurance that I can offer is that those families would come in the normal way, and an assessment would be completed, and then it would be a conversation between ourselves and adults as to how we manage that in terms of threshold, in terms of need, and how that looks for that young person. That assessment would need to be very much focused on that transition and what that looks like, and the needs moving forward, rather than where they're at right now in terms of not meeting a particular threshold, perhaps for children's, or a threshold perhaps for adults. It's really about, actually, we need to be very clear about what the future potentially looks like. So I would say that we would do that assessment, and then I would have a conversation with my colleagues over there in adults, and we would look at how we can best support that family. Now, what I will say is that in children's currently, we do manage a number of cases over in our targeted support team where they perhaps don't meet that kind of threshold to go and sit with C2A, but they have got a lot of needs and need access to some of those specialist services. There's good conversations that go on there already in terms of with adults, with our colleagues from adults, that actually they meet up, social workers will meet up, they will ask advice, they will say, how can I provide this particular service for this particular family? They sit with us, they don't sit with you. How do we do that? How do we make sure that these families are getting their needs met, rather than the worry of, actually, we've got a family here that could just fall through the net. Yeah. So I think what we do well is we already have those conversations. So hopefully that provides you with some level of assurance there. Craig, I don't know if there's anything you wanted to add on that point?
No.
No.
On that one.
Not on that one.
You want to go on to the next ones, or do you want me to?
That's fine. Do you want to go to the next one?
So the next one was around access routes. My understanding from this report, this is about families first, will previously coming into one number. So it's not, we will still have early help hub, but we will also still have our first contact team. So we're not closing every single route. I suppose for me, it's the point that you were making, which is that principle of there being no wrong door. Yeah. And it doesn't matter who you speak to, or the pathway needs to get you to the right place. And we can have one number, we can have 10 numbers, but actually it's got to work to make sure wherever people present, if they turn up at Flint, if they phone up and speak to admin, that people are really clear, there's no wrong door, you're going to be put through to the right people. And I suppose that's the work that we're doing around making sure that not just our staff, but all agencies who are working as part of the Families Hub, I think 16 agencies, all understand the pathway in and where it needs to go and how we manage that through. And so I think for me, it's us holding on to that ethos, not being fixated, did they phone the right number, but actually, where do they need to be and how do we get them to where they need to be? And then I think the last one was around the early help and families first. So I just want to give that assurance that not only are education and youth services and social services working together, but we've got a group which is called the Children and Communities Group that involves health, it involves youth justice, involves the third sector, around how we all have conversations and ensure that, as you say, when it's not information and advice, it's plus, it's something else. How do we get that support to those families? That group are meeting and working through those pathways at this point in time. But I'd want to give you the assurance that it's not just two portfolios, it's actually looking at the whole needs of the family and how do we take that through.
I think for me, it's important to let you know that what was being delivered was very effective, and families very much appreciated it, and schools as well appreciated that early help going in and working with vulnerable children. And as of, I think, April, that is now stopping. So it feels like there is a gap in the service, that the people that use that service don't really know what there is as an alternative.
And I think once that's established, getting that information out to people will be critical.
Councillor Thew.
Diolch, Cadeirydd. I'm just following on from Councillor Lister, really. I'm wondering whether, looking at the national statistics of numbers for children in our county as compared to other counties, our number of children is increasing where the neighbouring counties are decreasing from compared to Wrexham, our nearest neighbour, who have about 18,240 0 to 15. Our number is over 30,800. So what troubles me is this is not reflected in the numbers of primary school pupils, which is decreasing. So is that reflected in the work you do? Is it older teens that you're dealing with more than primary school age children, which is why you've changed the process with the younger children? It was just a query, really. Thank you.
To be honest, Councillor Hugh, I'm not wholly sure whether the figures are in the report, but I would just want to give an assurance that we work with, in children's services, Sarah's team work from preconception, and if they're looked after children with particular rights, all the way up to age 25. So that is our cohort, and we support that full range. So it doesn't matter whether you're a primary, secondary, or post-education, and even in employment or unemployment, our offer is for all children. But post 18 to 25, they are former looked after children who become care leavers. I don't know if I'm answering your question, to be honest.
It was just are the numbers of children you're dealing with in the younger age group decreasing, and older children are, you've got increasing amount of older children with more complex needs. Thank you.
I think it's certainly true when we look at our looked after population, we do see more teenagers, particularly kind of the post 13 teenagers coming into care, needing support. It's very rare young children come into the care system, though they do. I don't know if you've got a view around that, Sarah.
Sorry, yes. I think what we are seeing is a lot more complexity at the front door, what information that's coming in. Families are going into crisis quite quickly, and actually it's then around how we can manage those families in terms of their engagement, but also what support services they need. So I think in terms of what you're saying is, I don't think we're seeing less children at that in younger. I think what we're seeing is a more complexity. And in terms of the teenage age group, again, I think we're seeing a lot more complexity there. In terms of need, I go back to the kind of neurodiversity issues. We're holding and supporting a lot of families with a lot of complex needs around the ND profile. We're seeing a lot more of that in terms of the complexities. I know that that's reflected in schools as well. So I think it's more about the complexity rather than the numbers, if that makes sense.
Yes, thank you. And thank you for your report. It's very heartening to read your reports, and, the department's certainly going in the right direction. So thank you.
Councillor Cunningham. Councillor Cunningham, did you have a question? We can't hear you, Councillor Cunningham. You're still on mute. We still can't hear you, Councillor Cunningham. You're showing up as on mute. No problem. I'll move on, and if you can get the tech working, feel free to put your hand back up. I've got Councillor Healy next.
I've got it.
There we go. Go on, Councillor Cunningham.
Yeah, it's nice to be back on this committee. With social services and all the social care, it's nice. I enjoyed reading the report. We do an awful lot for children, and with neurodiversity and all the things that are going on in the world, it causes all kinds of problems. but it's also nice to see that we're taking adults into consideration. And what I like about being back on this committee is the work that we do. Councillor Mackey hit the nail on the head earlier on about scrutiny. I can remember being on scrutiny when I first came on this authority, on this scrutiny committee, and we were always talking about scrutinising and what goes on and how we can improve it. And I can see a great improvement in what we're doing, particularly in youngsters and with adults. And when we look at the new home that we've had built in Flint, it gives us beds for step up and step down, which is a great help to the hospitals. And I think Flintshire are doing the right job, and they're doing it as best as they can. And I'd like to congratulate the social services team in Flintshire for all the hard work that they do. Thank you, Chair.
Thank you, Councillor Cunningham. I've got Councillor Healy next.
Thank you, Chair. I've got two questions here. One is on children. Before children comes to the appropriate places, they need to be diagnosed by consultants. How many consultants do we have in Flintshire that go around diagnosing these children so they can get the appropriate help? And I find diagnosis has to be at a younger age. It's pointless diagnosing a child when he's already in secondary school. I mean, it's already, the problem has already festered. It's already there. And it's harder to help that child and get him out of that situation. That's one question and the other one is on adults. Now, I'm a great believer. We do a lot, but care of the elderly. We have got in communities, we've got complexes where there is for retirement, older people. But I find these complexes are mixed with people with other problems, and as well, young people. I have had them in my ward, and Ben will remember, where we had a young fella, and he had a lot of complex needs. And it's a bit like, haven't we learned from prison services, where we mix high-profile criminals with low-profile criminals, and the low-profile criminals learn from the high-profile criminals? And I think when we have got a complex for elderly, retirement elderly, we should try and keep them for retirement elderly. Do not mix them with people with other complex needs. And I think this needs to be looked into thoroughly, because we are creating other problems. Because the elderly, I mean, they want to have a peaceful time. They don't want to be knocked at the doors, people running up with complex needs. No, they don't need that. They need a place, a safe, and a place to rest. Thank you. Thank you, Chair.
Thank you. So in terms of the point that you're making around the earlier diagnosis, absolutely. There's a lot of work going on at the moment through the Regional Partnership Board, the RPB for the short version. And actually what we're looking at there, there's three priorities certainly at the moment, one of which is the neurodiversity aspect. And through the Children's Area Group, there's a profiling tool that has actually been developed, certainly in the East, and actually health, social care and education have all been involved in the training of that. and looking at exactly the point you're making in terms of how we can understand the needs of those families that are waiting and going through the ND assessment or pre-ND assessment. So in terms of and the earliest opportunity to be able to support those families, so there's a profiling tool being developed and being embedded, and that will be across schools, health, social care. It's a really good piece of work, so that's very high on the RPB, on the Regional Partnership Group agenda. So hopefully that offers you some reassurance that absolutely that message is being driven.
Just to add to Sarah, what Sarah said around agencies working together to support those young people and families, that is happening. But I can't shy away from the fact that there are long delays for diagnosis. They are, last I heard, about up to 3 years for children and families. And I'm hearing now that it's even longer. What we know is that children and families are coming to social services for support, and we are working through those. But it's a challenging situation for those individuals, for the schools, for social services, about how we get the best support and meet their needs. And some of that is around creating the right environments. But often families will tell us it's really important to have that diagnosis to help understand need. So I don't want to diminish, because the work's really, really important, but I don't want to leave an impression that there aren't long waiting lists. There simply are. And I know that's a national issue, but I know in North Wales, BCU commission organisations to do the assessments for them, which suggests that there aren't enough consultants to do that, and they're thinking differently around how they do it to get those families the diagnosis they need. Care of elderly and accommodation. I suppose what I don't want to stray into is housing specialities, because I know there was a review of sheltered housing to make sure that the housing stock is used, because what we don't want is housing stock available and homes available but sitting there vacant. So I know there's had to be rethinking about how we could maximise and ensure that we make good use of the housing that's available to us in Flintshire, and make sure that it meets the needs of our communities. And I think it's really difficult, all because someone has complex needs. It doesn't mean that there will be a set of behaviours, but sometimes there are, and it is about how we manage those communities. But in terms of the allocation of properties and accommodation, I would need to kind of bow to my colleagues in housing. Councillor Healy, I wouldn't want to give false information around actually how those decisions are made.
It's what it is. It's retirement homes, little bungalows, where young people are put mixture with elderly, young people with complex needs, and I mean complex needs. And this has happened, and it's still happening. And they are put in with the elderly. And to me, this is just creating other problems, because it's creating stress, anxiety, mental health for the elderly. So we are not helping our complex needs with housing. We are increasing it somewhere else with the elderly. So this needs to be looked in and seen that it doesn't fester. Thank you, Chair.
I'd suggest that might be a matter that needs to be referred to housing for a response.
Thanks, Councillor Healy. I've got Councillor Coppell.
Thank you. Thank you, Chair. Great report. I liked it. It's one of those ones, it's like a heartwarming report, isn't it, really? It smells of a good story. I think it needs to be advertised more, to be honest. I mean, because there's a lot of information buried in the report, it should be out there a lot, because it's good work. It really is. And it's complex work, and it's of it's a thing that unless you're involved in it, you don't see it. The outside world doesn't see it at all, really, unless you're one of those people who have a relative who have issues. But because this is scrutiny, and I do have a scrutiny type question, which I always sort of end up doing, not so popular, but there we are. So that was the good bit. When it comes to systems and processes, you're describing a multi-agency, 16 partnership event, which I've seen these before, where they work really well when they work really well. And when they don't work really well, they end up being chaotic. So when I've worked with these in the past, people have had systems to monitor how they actually function, whether the communication processes are actually working and working well. You've sort of alluded to that a little bit, and I was quite pleased to hear that you're having meetings, in fact, today, to talk about future-proof and resiliences, which are the big topics. But sometimes it's the spider's web of little stuff at the bottom that goes wrong and starts to make your organization less than it was last month or the month before. So the question is, how do you monitor the performance on a routine basis, which is not people-driven, but process-driven, in terms of which if you take the person out of it, it still works? How do you do that? Sorry.
Okay, so in terms of the operational side, then the operational side is very much monitored through those partnership working relationships in terms of the conversations, the data, what the data is telling us. But from the strategic side, I have the regular meetings as well with health, with education, with the police, with housing, all of those partner agencies. And it's through those forums that actually we talk about our partnership working, some of the issues that perhaps we need to improve on, some of the things that are working well, how we can strengthen. And actually what we're also doing is we just look at our threshold document that we're actually just updating at the moment just to streamline it. We're actually looking at rolling that out as well in terms of to include partners. So actually everybody knows what our thresholds are and actually what they can be holding and managing within their areas, what should be with us, what shouldn't be with us. So I think through that joint partnership working, being able to bring people in, which we do well, actually have some of that joint working, going to those various forums, like I will go to the Heads Fed meetings and the regional partnership board, all of those different forums that we're part of, which is all developing the work. Those are the forums actually we monitor very closely what the practice is like, what the partnership's like, what the quality is like, and what our performance is like. So I think we do that well. In terms of data, I would say we're obviously investing in a new system in the future. I expect Craig might come in or Jay might be able to say something about that. But we're investing in our new system, which is the Mosaic system. I think that's going to be able to, that really is going to help us as well in some of that rich data to be able to really drill into, particularly if we've got Power BI sitting alongside that, to be able to drill into the data that will not only tell us what we're doing really well, but also tell us what our relationships look like with our partners. So I think there's a way to go, but I think the forums that we sit in right now and the conversations we have give us that level of assurance. I'm hoping I've answered that.
Yes, that's great. The forums, are they all bosses that go to this? Or anybody that actually does the job? Are they all managers that go to these forums? And practitioners? Real, so they go as well. So if it's going wrong, normally sometimes managers don't know what's going on. I didn't ever want to, in my used to run a department, that's another story. But nevertheless, it's important, I think, that people on the floor who actually do the job have things to say. And sometimes that doesn't filter up to management level where you have the forums and have the chat. But if you're telling me that people on the floor attend, that's very strong. So that's great. Thank you very much.
Yeah, absolutely. And one thing that we always do is actually invite, say, can we get managers there? Can we get a representation there from practitioners? Because of exactly that point, making sure that the staff on the ground are able to contribute to what we can do better, because they have some really good ideas.
So if I just build on the point that Sarah made, if that's okay, about processes, an example of why the new IT system will really help. So if I think about, we've heard about NewKISS, so they're the organisation that do our assessments for carers and support for carers. At the moment, they do their work with carers, and that's here. We've got our system for the person who's been cared for. Actually, what we don't get from the IT systems is an holistic, integrated overview of that process and who's doing what. So there is communication, but actually the Mosaic system will help us get a more integrated process and data system so that we can actually get an overview about Craig as the person who's cared for and the carer and their own needs. So, you know, there's further work to be done, but that's an example of how the IT system will help us.
Okay, I think that's everybody who had indicated. Councillor Eastwood.
Diolch, Cadeirydd. Just thank you very much for the report. As always, I love the social services one because they bed so nicely into my portfolio, don't they? So, in relation to, and whilst I welcome reassurance that we won't be narrowing or restricting services, I do welcome the streamlined approach because I like just having one number to refer to and say these people will help you. Can you just reassure me that if they contact the IAA or the Early Hub, that you kind of signpost them out of your portfolio too, because it's often not just one problem that these families experience. And how are you going to be promoting the IA? So is it going out to schools, youth services, because they meet children in a different kind of environment, the wider community and members, because I think it's, unless you're sitting on the scrutiny, you're not going to read the report necessarily and become aware of it. And I think it's very important, at least in induction, that members know about the service or will know about the service. So that's that one question. And then in relation to the Mosaic system, is access to that going to be limited to Flintshire? Or is there going to be input from police like the police and the NHS? Because if it's going to be this holistic approach to caring for families, who's going to have access to that database? Because we've had concerns before that, you know, some children fall through the net, don't they? Because organisations are not allowed to share information. So is this one way that we're going to be able to combat that, or is it all going to be very restricted to Flintshire only? Thanks.
Okay, thank you. In terms of your first question around signposting out, absolutely. That initial contact is very much around what do you need, that kind of what matters, what do you need, where's the best, right service, right time, right team, right time. So in terms of signposting out, yes, I think the 16 partner agencies that sit around together in the hub, that again, that's very much important, very important to bring that information together in terms of, is there one partner agency here that could better support this family than the other partner agency? Or actually, can we send our family in a completely different direction? So yeah, those conversations all happen within that arena. So hopefully that has answered that part. In terms of, I think our IAA service and our early help service is very well known and very well understood. If that isn't the case, then I think we perhaps do need to do a bit of collaboration. My understanding is that it's very well understood and it's, you know, people know it's there. I think as we move towards a family hub model, that's our opportunity to really go out, I think, and highlight and showcase again everything that's going on in terms of Flintshire. In terms of the forums that certainly I attend and my colleagues attend, so managers and service managers attend, they are always talking about the ways that actually families can access support, and IAA is always first on the list in terms of can this family go through here rather than that way. So I think it's well understood, but if there are gaps, then more than happy to look at where those gaps are. Our education colleagues absolutely understand and are aware of our IAA system and services. So I'll be led by whoever needs to know. Okay.
if I just come in, because the third question was about the IT system and Mosaic. So in Wales, because we're not the only authority that are moving to Mosaic, there's been a national procurement. I think it's 16 authorities are going with Mosaic, others are doing other things, but we're all moving at the same pace and direction. All 6 North Wales authorities are going to the same system. But I would say the system is a stepping stone. So by that, I mean, what we are looking to do and the aim of this project. So there's a national project called Connected Care. And what we want to move to is a position where we've got what's called a shared care record. What we know is that we will never get to a point where we've got one IT system for Wales and everyone can go in and look at that system and look at the bits that they need to. What we are moving to is to identify the information that different partners need, irrespective of what system you need. So if you're in health, what do you need to know about me if I turn up at A&E at 2 o'clock in the morning? Do you need to know if I got a social worker? Do you know if I got substance misuse, certain things? So part of the work we're doing is to understand what a shared care record would look like for different agencies. So step 1 is to put the system in, the Mosaic system. That will be just Flintshire. We will be able to work with people within Flintshire to give access. So we know youth justice, education, certain people have got legitimate access to part of that, and we will continue that. The second phase is then, because there's no point us writing an information sharing protocol and doing all of that connection, Flintshire and BCU, they're a big beast. It will be done with the 6 authorities working to get the information governance and the transmission right, so we get that shared care record. But that's phase 2 of the project. So Mosaic won't sort it. Mosaic will be the stepping stone and enabler to get to a point where we would have a shared care record.
So we've got one recommendation in the report, which is scrutiny support the focus on work to align and coordinate pathways and access points into children's and adults' social care. Do I have a mover for the recommendation? Councillor Mackie, Councillor Lister to second. All those in favour? That's everybody. Thank you very much. And we'll move on to agenda item 7 now, which is effective reviews. And I'll pass over to Ben to introduce this item.
Thank you, Chair. Good morning, everybody. My name's Ben James. I'm the Service Manager for Older People. I'll be presenting a report today which focus on care and support plan reviews and Section 117 reviews for when people have been detained under the Mental Health Act. Where our duties come from for this, for completing assessments and reviews. Part 3 of the Social Services and Wellbeing Act places a duty on local authority to assess anyone who appears to have a need for care and support. The focus is simple. It's to understand what matters to the individual and what outcomes they want to achieve. The assessments have to be proportionate and they must be done with the person, not to them. And this will involve the important people with them, so they're individuals themselves, their carers and their families. The assessment process explores their needs, their strengths, the resources and aspirations, and it's built around that what matters conversations. So part 3 of the Act works hand in hand with part 4, which sets out the eligibility criteria and duty to meet needs. Together, they ensure that care and support planning remains person-centred, giving individuals real voice and choice. By working collaboratively, services can provide seamless holistic support that improves well-being. This approach also strengthens partnership work across sectors, including the third sector. When needed, a care and support plan is created and must be reviewed at least every 12 months for adults. Reviews check whether the plan is still meeting the person's needs, whether the outcomes are being achieved, and what support is required going forward. They can then lead to changes in the plan or, where appropriate, end statutory services. Both assessments and reviews emphasise people's strengths and the support available from families and communities. Statutory services should only be provided when no other safe, viable alternatives exist. Within locality services, a large proportion of reviews for people supported by locality, physical disability and learning disability teams are carried out by dedicated reviewing officers. 8 full-time posts plus a manager when fully staffed. As we can see from the data in 1.11, at present, unfortunately, not all reviews are completed within the timescales. This has been an improving picture, with around 75% of people who have been due a review receiving one over the last 3 quarters. When the local authority becomes aware that someone's needs have changed or that their current care and support plan is no longer helping them achieve their outcomes, we must actually take a reassessment. So this is more in depth than a review and goes back to the beginning. And this will mirror the same process as the original assessment. Alongside the Social Services and Wellbeing Act, Section 117 on the Mental Health Act places a duty on NHS and local authorities to provide free aftercare for people leaving hospital after certain types of mental health detention. This aftercare must specifically help to prevent readmission and must relate to the person's mental health needs. These plans must be reviewed at least every 12 months, and both organisations, us and the Health Board, must agree before aftercare can end. For Section 117 aftercare, responsibility for arranging the review is shared. The lead professional is usually the person coordinating the individual's care, which may be a care coordinator, such as a mental CPN, a social worker, or the responsible consultant psychiatrist. Both the NHS and the local authority must provide representation for these reviews, which are completed in partnership with the individual and, again, their carers and their family. And again, same with the Social Services and Wellbeing Act, reviews should take place whenever there is a change and at least annually. They're recorded through mental health measure paperwork and shared with the local authority, clearly stating whether the person remains eligible for aftercare. If they are no longer eligible, both organisations must agree before discharge from Section 117 can occur. Currently, Section 117 reviews are typically completed during the individual's annual appointment with a consultant psychiatrist, with the Health Board contacting the mental health social work team or other local authority team to ensure attendance. So in terms of reviews in general, both for Mental Health Act and care and support reviews, we are very aware that failing to complete the required reviews carries risks. So these risks would be to the individual's well-being, opportunities for sustainable service planning may be lost, and people's rights to voice control may be reduced. As such, we may maintain that regular reviews are essential. They ensure that support remains safe, proportionate, effective, and are aligned with the outcomes that matter most to the individuals. And members have previously been advised that the mental health social work team separated from the Health Board's community mental health teams in 2025. Since then, the team, alongside colleagues in adult services, have been working through the Section 117 aftercare reviews. At present, 47 people are waiting for a Section 117 review, and since April 2025, 203 reviews have been completed. So if we're then to look ahead, we know that reviewing officers will continue to play a central role in key improvement work across adult social services, including any right sizing and dignity projects that we will have. We have recently completed some changes to the hospital team, which means that they are now conducting more reviews once individuals have left hospital, which frees up capacity for the review team. And alongside this, a colleague service manager is leading work to implement recommendations on how to strengthen and streamline the review function. So this has begun last month and is expected to help the service complete a high proportion of reviews within a 12-month time frame. Together, we hope that these developments will improve outcomes for individuals, ensure duties are met, and help the local authority use its resources more effectively. Thank you.
Thank you, Ben. I've got Councillor Mackie.
Thank you, Chair. Thank you for the report. My first question, and I wrote it after I started reading this, and my first question is, why did we take over a system where 30% of the people involved hadn't had up-to-date reviews? I didn't quite get that. I would have thought that if you're taking over a system, then it's up to the people or whoever was responsible for it before to make sure it's up to date, because otherwise you're giving the person who's taking it over a number of issues to start off with. When I look at paragraph 109, it's to do with the responsibility for arranging a review, and I felt it didn't really explain who was responsible. It seemed a bit iffy. It might be this person, it may be this other person, and I wondered if that was causing problems and difficulties, because I thought it might, if the responsibility for organising these wasn't clearly defined. So we now have 8 full-time staff plus 1 manager handling these reviews. Is that staff that were previously working with us, or staff that have moved over to us, or I couldn't quite see that. It looks to me, when I looked at 111, that we might be averaging something like 150 reviews a month. That was just sort of doing some quick sums in my head. There's every likelihood they're wrong. With 8 staff, which would give us about 160 working days per month. And I wasn't quite sure how that would fit in, whether that was appropriate, whether that was relevant or what. But that's roughly what I got from the figures at 111. Sorry, I'm having a problem reading my notes. At 302, there's a comment about workforce shortages and recruitment pressures. Now, you did mention this earlier on when we were talking about the other report that we've looked at. Clearly, workforce pressures and recruitment issues are something that I get very, very worried about, because if you haven't got the staff, you can't do very much. So I wondered if you could give me some indication there. I'm sorry, it's not a very well put together series of comments at all. Do apologise.
If I can jump onto your second question first, and perhaps if Craig can have a thought about the first question. Thank you. So 109, so who organises reviews? So this is specifically for section 117 aftercare reviews. So as it says, there's a joint responsibility to complete the reviews. Generally speaking, if it is an annual review, we try and get that booked in on the last review. So, and then everyone knows when it's going to happen. If it's a review that is done ad hoc due to a change in need, whoever notices the change in need will take the lead in organising that review. Quite often, we will use the support of the responsible clinician, because they quite often have a secretary or an admin that would be able to support actually getting those invites out. So they will be key in that. But it is very much done jointly, and so everybody that needs to be there is there. Are you happy as that as an answer for that question?
still think it just seemed very something you get out.
So in terms of the number of staff completing reviews, so it's 8 full-time equivalents and 1 manager. It is not only these people that complete the reviews, that is the dedicated review team. Locality social workers will also complete reviews, hospital social workers will also complete reviews. So it depends on if a case is stable, they will then be passed to a review team for their annual reviews. If there's ongoing work being done by a named worker, that case will remain with that named worker for continuity, and that they will complete the review as well. So yes, and they are getting through a large number of reviews each month. They take different forms, the reviews, and some are quicker than others, and some are more complex than others. And a number of those reviews will lead to reassessments as well, which can take even longer then again, because we go back to the beginning with those reviews. Unfortunately, there are not currently 8 staff in post. We have 1 full-time vacancy in the older people's review team. We have 1 person who is going through the social work degree that we are sponsoring, so they are currently on a placement. So it is working very well for getting social workers, not so well for the review team. They were on a placement until July from February, and we unfortunately have 1 person that's been off or sick for a number of weeks, which probably indicates the 3rd quarter drop off in number of reviews being completed as well.
Why don't we just go for a system where there were a large number of us?
Do you want me to come in on that one? So I suppose for me, the first thing is why we're bringing this report. We're bringing this report because actually it's an area where we are putting focus and need to do some process and improvement pieces of work, but also a piece of work where we need to concentrate around recruitment and retention and workforces. So we're bringing this because we think it rightly should be scrutinised, because there are areas of development and we recognise that. And that's why we've given one of our service managers a particular focus to do a project around this. So just want to set some of the context. So in terms of taking over the system, so this, if my understanding is right, is the community mental health team. So up until the 1st of April last year, we, social services, were part of the integrated community mental health team in Flintshire. Across North Wales, all the 5 other authorities had moved away from those arrangements, and we brought a report to Scrutiny recommending that actually we moved away from community mental health team. And part of the reason for that was some of the demands on that team were meaning that our social care staff were being deployed sometimes on health responsibilities and activities, and didn't always have the capacity to do some of the social care activities, which are our core statutory functions and responsibilities, which includes reviews. So what this report acknowledges is that at the point of separation, we had a system where some of the reviews, of loads of the reviews, high number hadn't been done and hadn't been done in time. And they were our responsibility in that collective arrangement. In the new arrangement, we are able to deploy our staff because our managers say these are the tasks that we want you to do, which has meant that we've been able to give a greater focus on reviews and start to improve the timeliness of those reviews. I think we're being transparent that there is still a waiting list and we're working on that. But it explains for me part of the reason why we moved away from that community mental health team and what we've been doing since then.
Councillor Lister.
Thank you, Ben, for the report. It seems like a really impossible job at the moment to kind of, like, you've got increased demand, which means that you've got an increasing number of people needing What Matters conversations, which is probably then leading to an increase in demand of people on care and support plans, which is then an increasing demand for those needing assessment and review. And I completely understand that. And it is really, really difficult. So I guess I'm asking, are the resources that you have to complete all these going to be increased with the demand? And, you know, is, because this, you know, it's very important. And the other thing that I wanted to ask was, with the What Matters conversations that everybody's entitled to, aren't they, when they come to the front door, that everybody has, is that correct? They have a entitled to find out what their need is. I'm a little bit concerned about those who struggle to advocate for themselves, and will have a chat on the phone and say, oh, do you know what, I'm fine. And perhaps they're not fine. So I was just wondering what those What Matters conversations actually involves, whether it does involve visiting people and actually seeing for yourself. And I also realised by asking that question, that is another dimension of work as well. And yeah, I just feel like the resources need to be there to support that. Thank you.
If I answer the first part, if that's okay. So Scrutiny might recall that one of the areas that we have identified as a priority for the next financial year, which is just a week or so away, is relooking at our structure and making sure that we have the right people with the right skills in the right place. And I think I've said it before, I think that we recognise that there is no cavalry of social workers coming over the hill that we'll be able to employ and to be able to help us do those What Matters conversations, the assessments, the reviews. So part of that piece of work, we'll be looking at what skills and functions are there, what experience, knowledge, qualifications people need, and how do we align those. So actually thinking broader. So I know we've had community assessment officer posts who supports other not qualified social workers, but people who are experienced and experts at doing a certain level of work. So part of the review of our structure is really understanding what is the demand. So what's the demand in this case for reviews, and how do we keep pace with those reviews, and what different levels and complexity of reviews, and how we can deploy resources in a different way. So it's coming, I suppose, is the answer. Ben, did you want to answer about the proportion of What Matters?
Thank you. So in regards to What Matters, a lot of our initial conversations are held over the phone, as you suggest. There are other ways that people can contact in, and we are working on increasing those as well through our website. The staff, our SPOA staff, are very well trained in supporting people and working out those people who are saying, oh, don't worry about me, sort of thing. We will signpost those people to other services, and we then may get a second referral from that service. For example, a new KISS or a third sector, when it becomes clear that they really do need that support. But most of the people coming through the front door, we will capture and then go out to visit and complete a more in-depth What Matters conversation and an assessment. I think from the figures in here, you can see that we most of the referrals that I apologise, it might have been in the previous document. Most of the referrals come in actually get referred on to one of our internal teams rather than information and advice only. And then when we go out, that conversation is held face-to-face, involving other people. We will refer to other support services such as IPA, so independent professional advocates, or if someone lacks capacity, a mental capacity advocate, just to make sure that that individual's voice is being truly heard throughout the process as well. And we do get a number of referrals from our partner agencies all the time. So that feels like, by the number we're getting back in, feels like it's working as a system. So I hope that helps.
Councillor Claydon.
Dirk, just a quick point to indicate how things are going. It says that there's 47 people waiting a 117 review. How long have those people been waiting?
I apologise, Councillor, I don't have those figures to hand at the moment, but I can find them for you.
Councillor Mackie.
Do you mind if I briefly come back, following up what the Chief Officer said about the review that's taking place? Right, this isn't meant to be flippant. It has a point. When our grandchildren come to stay with us, they invariably get returned damaged, which I take as a good sign, to be quite honest. We normally go to mould minor injuries with them, because we're quite content that the staff there have got the skills that we need to patch them up, and so that we can return them looking reasonable to their parents. But there's no consultant there at all. And I think that that is the sort of way we've got to start looking at things. We've got to acknowledge that we can have experienced staff who don't meet the full range, and as long as they're appropriately managed and know their own limitations, that they can take on roles. And that, I think, is how not only ourselves but the health service has to progress if we are to have anything like an acceptable system, certainly in the health service and certainly in social services. I'm sorry, I just wanted to say that. Thank you for allowing me to.
Thank you, Councillor Mackie. I had a question on the back, it's sort of on the back of what both Councillor Mackie and Councillor Lister asked. I've been watching the Nottingham inquiry over the last couple of weeks, and that has kind of exposed how when this system fails, the consequences can be catastrophic. And I suppose it led to a couple of questions, because in the report it talks a lot about the needs of the individual. And this, I think, is where the what matters conversation comes in. And I'm wondering what the family involvement is there, because in the Nottingham inquiry case, this was an individual who had been sectioned 4 times, once under section 3, was refusing to take antipsychotic medication, and was also actively sort of encouraging that his family weren't involved in the process. So the family of the perpetrator, their view is that had they been more involved, those killings wouldn't have happened. And so I guess I'm wondering, as part of this process, how involved is the family? And in cases where an individual might not want the family involved, does the local authority and the health board take that as, okay, they've not asked for the family to be involved, so they won't be involved? And then that leads into a sort of a broader question about, we look at the current vacancies in the team, the problems with retention, the fact that, there's a significant number of people who are waiting more than 12 months to review. And I suppose my question is, how confident are you that we couldn't have a similar situation here as to what happened in Nottingham?
So if I take those points in reverse order, if that's okay, Chair. So the mental health reviews are not completed by the review team. Taking on view what Councillor Mackie was saying before, they are a higher level of competency is required for those reviews. So they are completed by the social work staff. Majority of those people will be supported by the mental health social work team, but a number are through the locality teams. I understand that the vacancy figures are not as high in the mental health team. In terms of the family involvement, that they would be involved as much as they are able to, as the law allows. So that would depend if someone's got capacity, for example. We've got to seek the views of everybody involved if they care if someone lacks capacity. If they are detained under the Mental Health Act, then we would have to consult with the nearest relative. And if they were in hospital, we would also have an IMHA, an independent mental capacity advocate, working with them as well. It's difficult to comment on any individual case. I suppose what I can tell you is a little bit about what we might do here. For example, if we knew we were supporting an individual and they had started to stop taking the medication, if we were aware of that as a local authority, we would tell the community mental health team. We would expect that then probably the care coordinator involved, which is normally for the mental health team, would be more involved, become more involved closely, and they would monitor them. We could then perhaps look at escalating that involvement to daily. We have such support as the home treatment team within Flintshire, and they could go in to support that person to take their meds on a daily basis. If the individual did lack capacity around medication, the responsible clinician could put in place a best interest decision, which might be around covert medications. And they would then be taken without the individual knowing. Other options may be that the responsible clinician may view that the individual needs to go back into hospital, so a further mental health act assessment. Or if they're on specific orders, such as a CTO, a community treatment order, normal conditions for CTO is that you have to take your medication. If you don't take it, you then get brought back into hospital. Another normal one would be you have to make yourself available for assessment. And again, if that consistently happens, then you'll be brought back into hospital. If we did then have some difficulties trying to find that individual, we could then get the support of other organisations such as the police to get that person assessed and readmitted to a place of safety where we could support them. So that's how it would hopefully work in Flintshire if we were coming to a situation where someone was struggling with their meds. I hope that clarifies things a little bit for you, Chair.
Yeah, no, thank you for that. It's a very detailed answer. And I think it comes back to what Councillor Mackey said. I think in that particular case, from what I've seen, the local authority so far hasn't come under much criticism, I don't think. But there is a wider issue about a lack of communication between, the social services, health board, the police, who are all involved and none of whom really seem to be talking to each other. So I think that's sort of reiterates the point Councillor Mackey was making earlier on. Do I have any other? Councillor Healy.
Thank you, Chair. I just want to say a few words here. And I'm speaking from what I've seen. Flintshire's consultant, psychiatrist, is a top man. He works very hard. And as well, there is quite a few specialist nurses, which are mental health nurses, clinicians. And when a person comes out of hospital, they come to the house to see the person. And they come quite a few times. I don't know how many times, but they come quite a few times. And after that, in Flintshire, I'm talking for Flintshire here. And after that, they've got healthcare support, mental health support workers, which are again top. From what I have seen and the experience I've seen, they are one of the best. They come to the house, they come practically every day when the person has come from hospital. And then after that, they tail off little by little, very little by little. And they report, the mental health support workers report to the specialist mental health nurse. And if they need her, she's just on a phone. That's what I've seen for Flintshire. I can only speak for Flintshire. As well, the support out there for mental health, I would say, is very good in Flintshire. Flintshire does do what they can. And I'm talking from when Sue was here. Sue, but she has retired. It was excellent. I just hope that support does not trickle down and with funding or whatever, because mental health is a big issue. It's a very, very big issue. Not only between elderly, it's a big issue between young people. Thank you. Thank you, Chair.
Thank you, Councillor Healy. Do I have any other members who wish to ask any questions or make any comments? Or should we move to the recommendation? There's one recommendation, and that's that Scrutiny support the ongoing work to respond to the demand for timely and effective reviews in line with statutory requirements. Councillor Mackie, move. Councillor Lister to second. All those in favour? That's unanimous. Thank you, everybody. I'm conscious that we're nearly at 12 o'clock. So would members like to break now before we move on to the next agenda item? Yeah, I think so. With it being lunchtime, we usually take 10 minutes, but I'm conscious that people might want to grab
20 minutes for lunch.
Okay, so should we take 20 minutes? Okay, so we'll say if people are back here for 12:10, we'll look to restart then. Thank you. Right then, we will move on to agenda item 8 next, which is quality of service provision in children's residential care home service, and I will pass over to Sarah for this item.
Thank you, Chair. Thank you, everybody. Okay, so this afternoon, I'm presenting the report to give you the oversight of the quality of service provision in children's residential care within Flintshire. In terms of the backdrop of this, since 2022, Flintshire Children's Residential Services has been built up from the Children's Residential Service has been built up from the ground to meet local needs, reduce out-of-county placements and deliver high-quality care aligned to the Health and Social Care Act 2025. You will know that to date there are 5 children's homes in children's residential provision within Flintshire, and CIW have inspected all, and all have come back with excellent ratings across the board, which I think is something we absolutely need to celebrate. The bar is high now, isn't it, in terms of where we go from here. You'll know that the service delivers a trauma-enhanced and therapeutic relational model that places the best interests and outcomes of children and young people at the heart of the practice. This afternoon, what I want to kind of focus on, and I'm going to keep this really focused in terms of time, we need to look at where we go next in terms of the continued development of our in-house provision. We also need to kind of take account of what the role is of the responsible individual for our children's residential. We know under the RISCA, which is the Regulation Inspection of Social Care Wales Act 2016, the RI, responsible individual, holds statutory accountability for ensuring that regulated services are compliant with legislation, well governed, responsive to feedback and strategically aligned, ensuring the services meet the needs. As part of their responsibility, the RI provides, it's a wide remit, it's a very wide remit, operational leadership, quality and compliance and strategic influence working at a national level. Now, RRI recently left us and went to work at Mel Jones and is now working for Action for Children. Significant loss for us. He's got himself a wonderful role with Action for Children, but we will continue to work very closely with Mel. So he hasn't got away. We've told him that clearly. He hasn't got away from us. but the service has been left in very safe hands with Abigail Patillo, who has actually been alongside Mel throughout all of the development. Craig obviously was here from the beginning, all of the development of our in-house residential, and she stepped into the role following a robust interview process and has hit the ground running and is bringing that renewed energy and also a good vision in terms of moving forward. So I just wanted to update you all with regards to that. In terms of building the children's residential service, we know this has been established with pace, moving from no in-house provision to multiple homes. We know that the not-for-profit agenda being driven by Welsh Government is very, very high on Welsh Government's agenda in terms of children and families and taking the profit out of residential care. So in terms of where we go next, this is obviously very time limited for us. Well, not time limited in the sense of we've got time, but actually in terms of the not-for-profit agenda, we know that the timescales are very tight there in terms of provision, coming on board and transitioning to a not-for-profit model, but also new providers actually registering to be not-for-profit providers. So the key features of our ongoing approach is about designing to meet local need. Homes have been developed already to reduce reliance on out-of-county placements, ensuring children can remain closer to their communities and maintain their vital connections. It's about evidence-based foundations. It's about a modern infrastructure. So homes are designed to be safe, nurturing and therapeutic environments. Unique delivery model. Each home operates with its own specialist focused and tailored approach. I think that's we need to really celebrate what Flintshire have done there in terms of each individual home, the children that are within that home, and actually it's bespoke. The model of care for them is very bespoke in terms of their needs. And then our innovation and continuous improvement, so building from the ground up, has allowed Flintshire to integrate digital tools, workforce development programmes and robust governance frameworks from the outset. So in terms of, I mean, you can see it from the report, all of the kind of ins and outs of what that model of care looks like. I don't need to labour that today because it's all there in terms of what the homes offer, what the staff offer, what the training offer is. I think in terms of where we go next, that's actually really important and how that's managed. So in terms, sorry, it's the end report. Yeah. Okay. So I was distracted then. In terms of where we go next, we know that we have a number of properties that we're looking at the moment in terms of developing what we need to do next in terms of our homes. We have consulted with staff. We have engaged with families and carers, and we are consulting with key professionals in terms of what it all needs to look like in terms of our infrastructure. So consultation is a massive part of where we go forward in terms of developing our in-house residential homes next. In terms of the provisions that we are looking at the Willows, which is, we've got a young person placed there already, actually, so we're looking at how we move that forward for a bespoke specialist need. And we're also working very closely with Action for Children and other partners in terms of developing in-house provision. So there's lots of ongoing work. Abby Patillo, our RI, is very much aligning to that with our planning teams and with our colleagues that are in Flintshire that help us kind of pull all that together in terms of the project plan around that. I think in terms of our homes to date, what we've proven with our homes to date and our residential provision today is actually what we can do when we've got the resources to be able to do it, when we've got the staff aligned to it, when we've got that key training programme and that model is very well embedded. So actually that's where we want to continue to develop and continue to make sure that we're able to meet the needs of the children that we know are going to need to use those resources. I think it's really important to say at this point, alongside all of this, what we are doing is making sure that children that can safely exit care and come closer to home is being done. And we are doing that as well. So it's really important to understand that in this context of as we are developing our in-house residential provision. We know that the cost of care is ever increasing. Every week, we are looking through our care cube process when we're needing to find residential placements for children or young people. We go into the constant negotiations, and the cost of care is increasing nationally. So we need to make sure that we continue to develop our in-house provision to be able to support the children that are going to need that in the future. And I think what we've done here in Flintshire is an excellent example of when you do it and you do it right, actually the improved outcomes that we have. And you'll see the case study that's within the report. It's a really good read. It also really does focus on actually when we get it right, we get it right. And so I guess what I need to kind of reinforce today is the need for that ongoing support with regards to the continued development of our in-house residential, which we're looking at a number of properties at the moment, alongside our target, with regards to the Welsh Government and the not-for-profit agenda. This work is going at pace. There's a team of people around this work. What I'm doing today doesn't reflect the work, presenting this report doesn't reflect the work that's going on in the background to continue to invest and improve our in-house residential offer. So I will leave it there and I'll go out for any questions.
Thank you, Sarah. I've got Councillor Mackie first.
Thank you. I'll be very brief, if I may. CIW have given amazing reports, amazing. We couldn't expect better. That, in my book, says it all, that we are providing exactly what we should be providing. I'm worried, a little bit worried, and I think you hinted about this, in the pressures on the responsible officer. I really felt, as I read this, that there was a lot of pressure on them. There's a lot to keep your eye on, along with the other things. I agree with you that paragraph 109 is amazing, and I think it shouldn't stay in the report. It should be somewhere else, because that says so much about what is happening within social services here in Flintshire. 110 also gives the people who've been affected, it gives the sorts of comments they've been making, and I can't not say that. I feel that the recommendations miss that we are not congratulating the department on what has been achieved. I think that should be in the recommendations, that we congratulate the department in view of the short timescale for setting up these establishments. To get a CIW report like that needs congratulations to be sent, in my opinion. Thank you, Chair.
Thank you, Councillor Mackie. So would you like to move a third recommendation? Or, I mean, it's possible we could amend this second recommendation, which currently says Scrutiny recognise the achievements of the service and the outcomes. And we could potentially say Scrutiny recognises the achievements of the service and congratulates them, on the outcomes secured.
Yes.
Would that be okay? Okay. Unless anybody else has got any questions of Councillor Claydon.
I'd just like to congratulate the team on this really great report that we've had, and having seen a couple of the children's homes, I can understand where it's come from. They're wonderful places to be in. I'm just wondering, perhaps this is one for later in a later report or not, but in the future, do we have any plans to have houses suitable for children with complex or profound handicaps? Because I think this is a group that also needs a bit of consideration.
Yes, we do. I guess it will link into the second report. Is that okay? Yeah, okay, thank you.
Okay, so there's two recommendations. The first one is Scrutiny note the responsible individual's assessment of in-house regulated services for children's residential care and support the continued investment in trauma-informed and therapeutic training and practice to maintain quality and meet future demand. And the second recommendation, as amended by Councillor Mackie, reads, Scrutiny recognises the achievements of the service and congratulates them on the outcomes secured by the in-house workforce in delivering high quality and effective care and support services. So that's moved by Councillor Mackie, seconded by Councillor Claydon. All those in favour? That's unanimous. Thank you, everybody. So with that, we'll move on to agenda item 9, which is Childcare and Early Years Capital Programme 2025-28, proposals for Ysgol Maes Glas, Ysgol Caernant and Sealand Youth Centre. And I'll pass over to Chief Officer Craig for this.
Diolch. So I'm presenting really today, and normally Byra folks would come, but Byra's on annual leave, so you get me instead. Gail's back? Yes. So, all positive. So Scrutiny will be aware Welsh Government have a capital programme for extending Flying Start childcare and the childcare offer and early learning across Wales. And they have criteria to be able to access that capital grant funding. Alongside that, we look at our childcare sufficiency assessment, and that assessment does a deep dive into where is childcare needed, what type of childcare, and ensuring that childcare is viable. So we put those two things together, actually what Welsh Government set out in their capital, and then also our local need and demand, and also take account of Welsh medium provision, co-location of services, and increasing numbers of childcare places where they are most in need and most viable. We've been working through, because there's so many places that need childcare and need support, we apply that criteria, and each time the programme runs, we work through which on the list is next. So the 3 proposals that we're putting forward for next consideration in Flintshire are Ysgol Maes Glas, Ysgol Caernant and Sealand Youth Centre. We do this work very closely with education and youth services. Just to give you, so the process is that we are working with those 3 sites at the moment to do a detailed business justification site, because it's fine there being capital funding. The actual crux of the issue is the revenue, and how do you keep this building used, making economically viable to run. So part of the business justification is ensuring it's the right provision in the right setting, and that it will be financially viable. If we get a lot across the line and that comes back, that business justification case is developed, then what we would do is put an application into Welsh Government for that capital funding, because they'd want to see their criteria is met, but also we're setting up a sustainable provision. If that happens, we would then appoint a contractor and commence the design and construction. We're at the stage where we're doing the business justifications, but what we would want to do is get to a point where if they stack up, then move to the Welsh Government and grant application. So just for context, a quick overview, Ysgol Maes Glas in Greenfield. What we're proposing is a construction of a new childcare facility, which would support up to 40 children. It would also include the construction of 2 rooms that would be used for supporting parenting contacts and parenting courses and health contacts. I think it's really important that we really think about the space and how we maximise the use of that space, and not just be constrained around traditional childcare, but actually childcare plus, I would call it. The second area is Ysgol Caernant in Conis Quay. Again, that would be construction of a new childcare facility on site that would be able to support up to 40 children. I haven't been to the site myself, but I'm advised currently the childcare provider operates in tandem with the school, but has to walk the children some distance to actually get to the school. This would put that provision on site. So that has huge benefits in terms of that removing that need to transport children back and forth. The third area is where we've been working particularly closely with our youth colleagues, looking at a centre that we have in Sealand and how we could repurpose that to ensure it remains a vibrant community asset. What we know is that there is a lack of childcare in Sealand, and also it's not an area where there's a lot of business, independent sector business. So what we are looking to do is run our own childcare for that area. So we already provide some childcare. This will be expanding our own in-house provision. And again, we would offer a crash service alongside that, so we can run parenting programs and parenting contact sessions, but also some office space to support collaborative working and partnerships. So we'd be working with the childcare development team, Flying Start, Play Service, health and speech and language and communication. And last time we heard the real importance around speech, language and communication, and we want to get that vibrant in that community. So in terms of resources, if we were successful, it would be the capital funding would be 100% funding from Welsh Government. The revenue and maintenance costs, that's where we get the business justification. So there is a model for hiring and charges from the childcare settings and bookings for community groups, etc. in the evening. School governing bodies have a hiring agreement for the building, and they are responsible for the maintenance of that building. So it's something that all parties enter into very seriously with a clear understanding that it is sustainable, and the childcare setting must comply with CIW standards. I think this is the third iteration of developments that we're making. So Bayer and the team are well versed. They actually just get on with it and make it happen. So we're just being transparent around this is the criteria we've applied. These are the settings that we are recommending. We're doing the business case, and then we would like to go to Welsh Government for the capital funding to develop these settings.
Thank you, Craig. Councillor Lister.
Just to say, I fully support this. It is very important that we provide enough childcare and wraparound care for parents so that they can get back to work. And yeah, all the proposals are brilliant. And I think we should be doing more of it as a county. As a council, we should be looking for every opportunity to expand our childcare and our wraparound care. Thank you.
Thanks, Councillor Lister. Craig, I just had a question. I understand you might not have the detail, but in terms of the Ysgol Caernan existing, it says there's an existing childcare facility which obviously they have to walk to. Is that facility owned by the council or not?
My understanding, not. You might know more than me.
It's a private provider that hires a space in the town, and they have to walk children along the D road to get them to school, and that provides the wraparound care for the school and other lower years as well, I think.
That's not an unusual arrangement. In fact, the majority that's the arrangement that happens. A private provider provides in that setting.
Thank you. Any other members wish to ask any questions or make comment? If not, we'll look to move to the recommendation, which is that the committee recommends Cabinet approve the 3 projects outlined to proceed to the procurement, design and construction stages of project development, subject to Welsh Government approval of the capital grant. So do I have a mover for that? Councillor Lister, a seconder. Councillor Claydon, all those in favour? That's unanimous again, thank you all. Agenda item 10 is Welsh language in social services, which I'll pass over to Jane Davis for this one.
Diolch yn fawr iawn, Cadeirydd, Nawn da, Cynghorwyr, braf iawn eich gweld chi.
afternoon, and nice to see you all. I won't do it in Welsh, you'll be pleased to hear. So, but thank you very much for the opportunity to share some of the developments and training that's been going on for our staff within social services with regards to Welsh language. I'll take you quickly through the report if that's okay, but as you well know, there is a lot of legislation regarding our requirements as a local authority to support the Welsh language, and also, more importantly, to support individuals who we look after throughout the services that the council provides, and to ensure that that is done bilingually. The legislation for us in social services is quite specific, and I think that's because of the vulnerability of some of the people that we work with, and also the opportunity to ensure that they have their voice heard, as we have heard already in earlier reports this morning and this afternoon. One of the key measures that we adhere to is the 2011 Welsh Language Wales measure. This was a groundbreaking piece of legislation, particularly because it introduced the role of the Welsh Language Commissioner. And the Welsh Language Commissioner is the figurehead who supports us with our development of the Welsh language across the council, but also challenges us when that is felt to be lacking in any part. Social Services and Wellbeing Act, you all know it off by heart by now, I imagine, but also makes very close recommendations regarding the use of Welsh language, particularly, as I mentioned, around person-centred care and ensuring that individuals receive the care that they require, but they receive that in a way that enables them to participate in the conversation and to co-produce the care that is required for them. Another key piece of legislation for us in social services was the 2012 Welsh Government Strategic Framework, known as Mwy na Geiriau, or More Than Just Words. This is an underlying principle in the work that we do within the service. It introduced the active offer, and the active offer is, in essence, that people should not ask for services to be provided in Welsh. We should offer it to them without them asking, and that is a clear definition within the Mwy na Geiriau framework. So the responsibility very much lies with the service itself and not with the individuals. And then, as you can see in 1.05, the regulation and inspection of social care Wales, or the RISCA guidelines, as we often talk about, is the regulatory guidance that our colleagues within Care Inspectorate Wales, or CIW, utilise to ensure that all care providers and local authorities adhere to. And as part of that, they will inspect our Welsh language service offer and the prominence of Welsh language within the service. Craig's already made reference to the fact that we've had an adult services inspection the last couple of weeks, and whilst we've only had verbal feedback, it was a very positive response to the Welsh language offer currently made by staff, and a very positive response to the awareness of Welsh language within the service as well, which is heartening. As you'll see, what are we doing in Flintshire at the moment? There's lots going on, but I'll just draw your attention to the numbers of Welsh-speaking staff. So year on year, we've seen a steady increase in the numbers of staff who speak Welsh at the different levels within the language skills framework. Level 1, our staff we're concentrating on currently, because there are a number of staff who identify themselves as having 0 Welsh language skills, but anybody who's been brought up in Wales and educated through the medium of English will have level 1 Welsh skills. They can say bore da, they can say pnawn da, they can read the word araf on the roads and know that that means slow, hopefully, and listen to the lifts and all those sorts of things. And that is level 1. That basic understanding is level 1. And so we're working with our corporate colleagues to enable staff to recognise that in themselves and to move their skill level up to level 1. We also work closely with our staff to share with them the opportunities that are available to them to learn the language as an adult, or to refresh the language that they once learnt as a child and now want to come back to, and to help them to build their confidence through that. As you'll see, we've got 1,141 staff at the time of writing, working within social services. 99.4% of those have Welsh language skills of level 3 or above, which means that they can hold a quite intermediate to high level skill based conversation around the services and the care and support an individual may need. And on top of that, 14% of our workforce are able to hold a basic level conversation and to understand some of the basics that an individual might present them with. And that sits with the Office of National Statistics figures for Flintshire, where 12.2% of Flintshire residents aged 3 and over are reported to be able to speak Welsh, and that was reported in the most recent census in 2021. So there's lots going on in Flintshire to continue to promote the language. We work very closely with our corporate colleagues and Coleg Cambria, who deliver our bespoke training for us. But also we do a lot of activity. And if Chair is happy, I'm just going to quickly share with you a video that our colleagues in Plasero and the Extra Care site in Holywell did to celebrate Dydd Gwyl Dewi, St David's Day, back in March, or earlier this month, I should say. The month hasn't finished yet. So fingers crossed for the IT. Sharon, here we go.
Gwyl Dewi hapus gan bawb Plasero. Yeah!
Dydd Gwyl very hapus. Cymru am byth. Wales!
Dydd Gwyl Dewi hapus. Dydd Gwyl Dewi hapus.
Yes.
Gwyl Dewi hapus.
Dewi hapus from the district nurses.
Bore ta, Sharon. Sut wyt ti heddiw?
Dydd Gwyl Dewi hapus.
I think I'm running out of technical know-how at that point. So it's off now, isn't it? There we are. So it gives you a flavour anyway of the fun and activities that have been going on at all of our sites across the provider services. So all the care homes celebrate Dydd Gwyl Dewi, as well as our extra cares, as you saw there. But outside of provider services, there's a lot of other activity going on. We're part of the Adfer project that is being piloted by Bangor University at the moment, and this is all about using what little Welsh you have in the workplace. So as a team, identifying how much Welsh you've got, and it might be enough to say paned or dach chi isio paned, or do you want a cuppa? And that is enough. Or it might be that your Welsh is better than that, and then you can help and support others in the team. And it's app driven, so that it gives you tasks to do every day, so that you can remind yourself to have those conversations with your colleagues. And in having that general raising of awareness, we find that over a period of time, Welsh becomes more prevalent. And I think you'll have heard it today in this meeting. A lot of members I've noticed have been saying bore da or diolch yn fawr, or just using the language officers the same. And that's the secret to this, isn't it? Is dipping back a little bit, as they say. We're also running Paned a Sgwrs sessions across 3 sites. Here at Tŷ Dewi, there's another one on Wednesday between 2 and 3 in the canteen. If anybody's interested, please come along. I'll be there. And also we run them at our site in Altami, at Flint in county offices, and also at Unit 2 down in Flint Industrial Park, where our mental health services, a part of them reside. We have 6 Welsh language champions within social services, and their role is to help and support colleagues, whether it might be with recruitment, it might be with a conversation, it might be with a little bit of translation, however it might find its way. And they were also very prevalent at the Eisteddfod in Wrexham back in 2025, and a lovely picture of Mared there in the report. Diolch yn fawr. It was great to have such support across the council from members and officers attending the Steddfod, and also being willing to be part of the stand and to support the local community through the medium of Welsh. So activity-wise, I've included, it does say Appendix 2 and 3, but they are hyperlinks. I'm sure you've picked up on that. But we obviously attend to the Welsh language standards, and we contribute to the corporate annual report that supports that. We also have our own sector-specific reporting that we need to do, and that is through the North Wales Mwy na Geiriau Forum that I attend on behalf of the service. And the governance structure attached to that is that reports are then presented to the North Wales Regional Partnership Board on an annual basis. Social care particularly has some specific requirements for Welsh language around supporting people with their care and support, and Social Care Wales have created a range of resources that are available to us, which we utilise regularly. And then finally, our next steps, obviously to progress those Welsh language 0 level individuals to level 1, and then to make some inroads into moving our level 2s and 3 individuals up their skill levels, and that will be supported through our corporate team and the in-house workforce development team within the service as well. We want to promote the use of Welsh language champions. And also we appreciate, and I've talked about this already, that Mosaic is coming online, our new IT system. Sounds like the Holy Grail when we talk about it, but it is only an IT system. But it will assist us with the recording of the active offer, so that we make sure that all those offers are accurately recorded within our statistics. And also ensuring that where necessary we can utilise large language models or AI to support us in the future. I won't go on any more, Chair, but happy to take questions.
Diolch, Jane. Any questions from members? I had a question which was, sorry, Councillor Eastwood, go ahead.
It's my portfolio, you go first, it's fine.
Thank you. Yeah, I suppose I was wondering, given the number of staff who can speak Welsh to level 5 is relatively small, for somebody who might go into a care setting and be a fluent Welsh speaker or want, their care in Welsh, is the staff sort of sufficiently spread that somebody could get all of their care carried out in the Welsh language?
Thank you, Chair. Yes, is the answer. We have staff in all areas across the authority. I haven't broken down where they are, in which services they are, but there are staff members who can speak Welsh across the services. For a standard care setting, level 3 is probably sufficient, because that is the conversational Welsh. It's the Welsh that you would have with your neighbour, your family. Level 4 and 5 tends to be more specific around the technicalities of work and the technicalities of reporting. So, for example, presenting here today, you'd be expected to be at level 4, potentially because of the complexity of the language, but level 3 is more than sufficient for conversation Welsh, and it's heartening to see that those numbers are starting to increase, and that's why we want to concentrate on that level 2 and 3 cohort going forward, so we get those language levels a little higher and move them up the tree. So thank you.
Councillor Bibby, did you want to come in on that point?
Just very briefly, Mr. Chairman, I think thanks very much for raising that, because that was a point I was looking at. Because yeah, just and I can imagine we're only talking about quite a very small number of people, but I'd imagine within the county we do have, I would say, particularly maybe some elderly individuals who have grown up Welsh as a first language. Obviously, we imagine that be the rule rather than an exception in a place like Gwynedd or Anglesey, but I'd still imagine there's still not an insignificant number. And yeah, it was just the reassurance that sort of that you're able to provide, because I can imagine you could have a dementia patient, a stroke patient. You know, I can remember my grandmother had a stroke, and despite the fact she was a first language English speaker, but her parents were both Welsh speaking, for some reason she lost her ability to communicate in English after the stroke, so could only make herself known through Welsh. So I don't know how or why that happened, but yeah, it's just that reassurance to show, you know, particularly with those elderly people or people who are in a very vulnerable situation who, you know, their preference would be the use of the Welsh language to articulate themselves.
Thank you, Councillor Bibby. You've actually hit the nail on the head as to why we have Mwy na Geiriau as a framework, because it concentrates on individuals who may well only be able to communicate in Welsh, as you're making reference to there. Often people who are living with dementia, as they regress through their condition, they will often revert back to maybe their first language, which could well have been Welsh. Also, children may also find it difficult if their first language Welsh in a Welsh medium primary education setting with parents speaking Welsh can often find it difficult to communicate, and learning disabilities as well can be a challenge. So that's why Mwy na Geiriau was set up. It just reminded me as well, we have done some work with our independent care providers regarding their workforce. So obviously our own workforce, we can throw the resources that we have available to them, but also we have a commitment to our independent sector providers, and so we raised the profile of Welsh language with them, but also we were fortunate a couple of years ago to get some funding through a grant from Welsh Government to support care staff to undertake a short, sharp Welsh language course. So it lasted 10 weeks from memory, and it was to bring people up to that conversational level that the chair was mentioning before in a care setting. You don't maybe need the technicalities for medication. What you do need is to be able to have a conversation, and it's important that we continue that piece of work. But you're absolutely right in your reflections.
Councillor Eastwood.
Diolch, Cadeirydd. It's a good job I let you go first because you took my question. Adroddiad gwych, diolch yn fawr am hyn, and thank you very much for the work that you did in supporting us in relation to going to the Eisteddfod as well. You were one of the key contributors, Jane. Diolch yn fawr. I'd be interested, not necessarily for today, but if there's a difference between levels for people's ability to understand Welsh as against able to speak Welsh, because I know there's a big difference in my ability. You can withdraw on all day and I'll understand most of it, but don't ask me to come back to you much sometimes. So that would be interesting, isn't it? Especially with the oncoming use of AI and stuff, that you might be able to respond. Yeah, I can understand in Welsh, and then I'll Google translate it, and then I'll be able to respond in Welsh. That makes sense, is it? So perhaps we can look at developing that. And I just think the key bit, isn't it? The reason, I mean, I know we have the standards and we need to comply with the legislation, but I think the real key reason why we need to do this is embodied in 109, isn't it? When someone speaks your language, it's easier to express your feelings and feel that sense of belonging. And I think it's important for us all to remember that's the driver behind all of it. And in relation to just raising awareness of the Welsh language, we know in education we go on about children being able to hear Welsh being spoken outside of the classroom to make it relevant. And so diolch yn fawr for all your support in relation to our raising the awareness of the language within the council. Diolch.
I can't see anybody else indicating, so we'll move to the recommendations. There's two of them. Members review the variety of activities being undertaken by social services to comply with Welsh language legislation requirements, and that members assess the effectiveness of the Welsh language activity being undertaken and support future plans. Councillor Bibby, are you moving that? Councillor Healy to second. All those in favour? That's everybody again, thank you. So with that, we'll move on to the final agenda item for today, which is removing profit for looked after children, and I'll pass over again to Sarah for this one.
Thank you, Chair. It's very hard to actually separate the report I did previously to this one because the two are very linked in terms of our RI, Abby, who I spoke to you about earlier, and actually all of the work that we're doing to develop our in-house, and her role linked to also the ongoing removing profit for looked after children. So apologies if I've kind of linked the two, and at times perhaps the two have overlapped in my discussions, but I will keep very focused on how we are continuing to move ahead with regards to our major reform to end private profit in the care of looked after children. This is obviously driven by the Health and Social Care Wales Act. The legislation received royal assent, and will make Wales the first UK nation to require that children's residential care, foster care and secure accommodation are delivered only by public sector charitable or non-for-profit organisations. Under the new legislation, local authorities must demonstrate a clear and strategic approach to developing sufficient placement capacity. This includes preparation and publication of local authority annual placement sufficiency plans by December 2026. A local sufficiency plan will be developed once the relevant regulations and guidance on the format and the content of the plans have been issued by Welsh Government. Collectively, the programme positions the local authority to meet legislative requirements, improve sufficiency and enhance outcomes for children. The report seeks approval to develop or acquire up to 2 properties per year, with delegated authority to make offers on properties up to an overall annual budget of 1 million, subject to gateway reviews. This will help build a resilient and financially sustainable residential estate to meet projected need. Delegated authority has also sought to recruit the staff needed to each new residential home as it opens, ensuring the service is ready to operate without delay. So this report summarises the significant programme of work underway to expand in-house residential and foster care provision and strengthen our placement sufficiency. In terms of explaining the removing profit for children, I've mentioned that this is very much driven by legislation. The key dates are there in terms of no new for-profit providers, fostering agencies or secure accommodations will no longer be allowed to register in Wales from April 2026, and existing providers must transition by 2030. The policy aims to ensure that public money is reinvested into children's welfare rather than extracted as profit. It responds to ethical concerns raised by children, young people and professionals about profit making in care. As part of this reform, local authorities are required to strengthen their sufficiency planning, which I've spoken about. A key element of sufficiency planning is the requirement to manage the transition away from for-profit provision. Local authorities must outline how they will support existing private providers to convert to not-for-profit models and how they will safeguard continuity for children currently placed within private settings. The transition must be carefully phased to avoid disruption and to maintain placement stability throughout the period leading up to 2030. The legislation does place strong emphasis on regional collaboration. Sufficiency planning must be developed in partnership with regional partnership boards. The regional approach is intended to create a coherent and sustainable care system, avoiding duplication and ensuring that specialist provision, and this picks up the point that was raised earlier, is developed in a coordinated way across wider geographical areas. Financial planning is another critical component. Local authorities must provide realistic, costed plans that show how they will maintain market stability, invest in new provision, and ensure value for money with a not-for-profit system. Workforce planning must be also addressed with clear strategies for recruiting and retaining foster carers, develop the residential care workforce, and ensuring that staff have the skills required for new models of care. So, service developments in 25-26. We are progressing a lease agreement for a home that has been refurbished to the required standards for children's residential care in partnership with First Choice Housing. So this is the work that's ongoing at the moment. The property will become a high-quality home for 2 young people with significant and complex needs, offering a stable, therapeutic, trauma-informed environment and personalised support. We're also purchasing an additional property due to complete by year end to support 3 to 4 young people with complex needs. This development will expand local sufficiency, reduce reliance on high cost external placements, and enable to remain children closer to their communities and support. We're also working with our housing portfolio and care and repair to secure funding and arrangements to lease a registered 2-bedroom short-term assessment home, providing a safe environment for focused assessment and improved placement matching. So for those young people or that child that comes into there, it will be kind of a holding place, an assessment to look at actually that breathing space to actually where can we move them on to. Gives them chance to regulate and get themselves into a better position under that trauma-informed model we've spoken about earlier. Action for Children have a proven record of delivering high quality residential care to Flintshire children at our Arosfa Short Breaks home, as well as placements made by the local authority in their homes located in Wrexham and Denbighshire. The organisation has required a property in Flintshire that is being developed to provide residential care for children and young people, and we're working in partnership with them currently to maximise the opportunities to support local children wherever possible. We're also working with one of our providers that we've worked with for a long time. They are opening a new provision just over the border in Wrexham, on the Wrexham-Flintshire border, and actually we're working very closely with them also to think about children. They're going through the registration process at the moment, and we're working closely with them to look at children that we could match and bring back closer to home. So that work is ongoing already. As you can see, there's lots going on. So the property acquisition and workforce planning that kind of sits around this, the council's constitution provides delegated authority to a chief officer to authorise the acquisition of land not exceeding 2 million, provided that the offer represents best price reasonably obtained by the authority and that the value represents no more than the market value of the land. It is proposed that the Chief Officer Social Services uses this delegation to acquire up to 2 properties each year at a maximum purchase cost of 1 million for both properties. This will be subject to the budget being allocated either through the Council's own capital programme or through a funding allocation awarded through Welsh Government's capital funding programme aligned to the elimination of profit agenda. Offers will be routed through valuation and estates to ensure that the proposed purchase represents market value and follows due process. All acquisitions will follow gateway reviews to ensure alignment with needs, strong governance and value for money. Expanding not-for-profit provision will strengthen sufficiency and deliver stable, trauma-informed, child-centred care. As the market shifts across Wales, there are immediate risks to placement sufficiency, especially with the requirement that all new children's homes operate on a not-for-profit basis from April 2026. This also prevents existing for-profit providers from expanding under their current model. And so to manage this, we are developing a flexible, skilled internal team that can respond when children's needs escalate or when placements are unavailable. So Abby, who I spoke around earlier, is working on the recruitment of those staff members. This added capacity will strengthen service resilience, protect quality and ensure timely, consistent care when external provision cannot be secured. And it also means that we'll be able to train those staff members under that trauma-informed model, and we'll be able to have that consistency of care, even though it's on a temporary basis, and we can manage that risk with that training and with those bespoke workforce that we've employed ourselves, rather than relying on high-cost agency when the quality of the care can sometimes be really compromised. In terms of fostering, to meet rising demand and secure long-term sufficiency, we will continue exploring all viable delivery routes for expanding residential provision alongside our in-house fostering. In December 25, a report was presented to Cabinet to update on the development and expansion of in-house fostering. So you will have all remembered that report. But within the national context, and despite a UK-wide shortage of foster carers, Flintshire continues to retain a strong, experienced fostering community. Strengthening local fostering remains a priority, and the 3 initiatives to support this are long-term recruitment and retention, the Mockingbird programme in terms of our 4th and 5th constellation, the Llael fostering work stream with our Reconnect project, and the expansion of the Special Guardianship Order Service. And Flintshire continue to discharge children from care successfully through the Special Guardianship Order route to remain with connected carers. So these initiatives collectively enhance placement stability and support Flintshire's commitment to high quality, not-for-profit, family-based care. Alongside this, the authority is in early discussions with a small number of providers who are interested in transitioning to not-for-profit models and operating services to support Flintshire children. So I've spoken about some of those already in terms of those partnerships. In terms of where we go next, you can see that there's lots of development in terms of where we're going to fulfil our business case that we put to Welsh Government in terms of the funding that is wrapped around our in-house residential expansion. So there's lots of work going on, as you can hear from all those provisions. Today, obviously, I just wanted you to have oversight on this and to be able to scrutinise that forward work that is ongoing and actually look at the recommendations from today. So thank you very much, and if there's any questions.
I'll open up to members now. Any questions? Councillor Bibby.
I think quite a bit of this has been covered within the report, but I think there's just some ongoing concern. I mean, it's fantastic news that we've, significantly expanded in-house provision, but I think there's just an underlying concern, isn't there, that given that we are still very dependent on the private sector, and it doesn't appear like any similar legislation is, coming over the horizon over in England, is there a concern that private sector providers may just decamp over the border? And I think particularly with us so close, is it the case that a private sector provider will go, well, if we can't make a profit, we'll scuttle over the border to Cheshire and open the facility? That's just one thing that I'm quite concerned about. It's an incredibly progressive piece of legislation. It's just, whether private sector providers and the market just reacts in a particular way.
I think there are particular risks, as you point out, with us being a bordering authority. I think that brings some uniqueness that other authorities in Wales don't face. I think, building on what Sarah said, is that we're in active discussion with third sector organisations who are being very proactive around developing provision here in Flintshire. We had another meeting, didn't we, fairly recently. But also, I need to be really clear on this. We know who the high quality independent sector providers are in Flintshire, and we are in active discussions around their intentions. And there are some, as you reflected, that are willing and actively engaged in moving to the not-for-profit, because what we're fortunate to have is some providers that aren't the big national global providers who kind of have a children's home, but all the money goes offshore into hedge funds. We do have some family run good quality provisions, and they're very keen and committed to Flintshire and are looking at how they move with support to that not-for-profit model. So I think it's that mixed economy of us developing with pace what we can, working with the third sector, working with independent sector that want to move in that direction. But also we are having some conversations and are opening a provision with a housing provider. So I think what we're trying to do is spread the risk, if that makes sense, so that actually we're not just saying, well, we'll develop it all, or we'll let the market take, will take care of itself. We're being proactive across a range. The area I would say, though, and I don't know if you agree with this, Sarah, is where we're more challenged, I think, is fostering. So we are not able to use independent fostering agencies that operate in a for-profit. Nationally as well as locally, it's really challenging recruiting foster carers at the scale and pace that we need. That's why we've got the Reconnect project, which is really working to do that. But I would say that if, the balance of where the biggest risk and pieces of work that we need to be doing, I would say, is around fostering. I think we've got a programme around residential. We've got work with fostering, but it's much easier to become a movable organisation. If you've got a registered children's home and it's built and it's in, popping over the border is more difficult, isn't it, with that provision? If it's foster carers, you haven't got that fixed asset.
Any other? Oh, Councillor Thew online.
Diolch, Cadeirydd. I'm really pleased to read this report. I know how costly it's been to place children out of county. I just would like to ask, is a leasing arrangement a better option than purchasing a property outright? And also, how many years will the leases be for? If you could give me some indication of that, thank you.
My preference would always be to own the building, and that our strategy is around owning the buildings. That's where we're reliant on Welsh Government capital money to purchase and develop properties. There is one, as you quite astutely pick up on, Councillor Thew, that with the Housing Association, we've entered into an arrangement. It's going to be a 5-year lease with break clauses in that. And the reason we've gone for that is that that property is ready. It's a bungalow. It's adapted. It was going to be used by the Housing Association for another purpose. That fell through. They came to us. It's in Flintshire. We wouldn't have to do any capital investment. So we're signing the lease for 5 years to give us that sufficient time to have a run at it, but with break clauses. But I would reiterate, our strategy is to actually develop and own these houses. What the way we're developing because of needs is they're fairly small properties. So actually, if it came to it, we could legitimately repurpose. So for people with learning disabilities, so we're thinking about the whole life cycle, and this is what the need is, but actually not investing in great big buildings that would become problematic in 10, 15, 20 years' time if needs change.
Thank you for that. Diolch yn fawr iawn.
Okay, we've got 4 recommendations. I'll summarise them. First is that Scrutiny note our strategy to develop or acquire up to 2 properties per year for use as residential children's homes until 2030. The second is that we recommend Cabinet provide the Chief Officer with delegated authority to make offers up to a total value of £1 million, subject to the reviews in line with the Constitution. And further, that the committee recommends Cabinet provide delegated authority to the Chief Officer in consultation with a Cabinet member to recruit staff needed for each of those homes, and that Scrutiny acknowledges the progress made in Flintshire to prepare for the removal of profit from children's care. So do I have a mover for those 4? Councillor Bibby, seconded by Councillor Claydon. All those in favour? That's everybody. Thank you very much. And that concludes the meeting. So thank you all, diolch. And I don't think we have a meeting now for a couple of months because of the election period. So see you all when I think it's June, isn't it? We're doing another meeting. So see you all in June. Diolch, thank you.